we're back again. Red eyes turn rough, vision's on the line, this ain't no bluff. When pain hits hard and pupils won't play, here's what to treat and what each med will say.
Corneal abrasion kicks things off. Pain with blinking light makes you scoff. Scratch from trauma or foreign bit. Eyes tearing shut tight, a gritty hit. Stain with fluorescing green lights the trail. Linear defect, that's your tale. Red flags like infiltrate or cloudy haze. Could be infective keratitis, change your ways. First line topical chloramphenicol. It stops bacterial protein synthesis, stalls the brawl. If pain's intense, cycloplogics go far. Like cyclopentolate, a muscle relaxer for the ciliary bar. It relieves the ache and helps pupils stay wide. But if vision's threatened, refer, don't hide. Acute angle, closure glaucoma, brings pain and pressure. Sudden vision drop, that's no lesser. Mid-dilated pupil, hazy cornea glow. Halos around lights, IOPs on show. Red flags, they're all around. Nausea, firm eye and visual ground. Act now, meds come in a pack to push that intraocular pressure back. Acetazolamide IV, it's the first to go. A carbonic anhydrase inhibitor reduces aqueous flow. Timolol drops next, a beta blocker crew decreases aqueous production too. Then pilocarpine, a tricky player. It's a meiotic, constricts the pupil, clears the layer, helps open the angle if the cornea clears, but only once IOP drops from the frontline peers. Refer ASAP for laser relief. Iridotomy saves optic nerve from grief. Anterior uveitis brings dull, deep pain. Ciliary flush and blurred vision again. Photophobia strong, pupils small and tight. History of autoimmune, you might be right. On slit lamp exam, you'll see that flare. Cells floating in the aqueous, light in the air. Treatment starts with prednisolone drops. It's a topical steroid. Inflammation stops to prevent synechia. Cycloplogics come in like atropine or cyclopentolate. They dilate from within. This relaxes the iris and relieves the pain, letting steroids work while keeping shape sane. Red flags, vision threat or posterior view. That's for ophthalmology, not just you.
That's the danger zone, meds in line. Each has a purpose, rhythm and rhyme. From aqueous flow to pupil tone. Treat the red eye like it's your own. Know the drugs, know when to refer. That's how GPs ride.